other men's health issues, including how to get rid of erectile dysfunction. Do you know that there's a new laser treatment that can shrink enlarged prostate without surgery? You don't want to miss this. Ladies, there's information for you as well. So join the Men Talk team of George, Riquen, and me, Noel Professor Richards. Our guest is specialist urologist Dr. Lester Goetz. It's Men Talk, Saturday 30th April, 8 p.m. on FBN TV, Isaac The Promise Facebook page, and Isaac 98.1 FM The Promise. Sponsored by Anaya Tony, the Feet Lady.
Hello.
Hey Jack, you missed the meeting yesterday, boy. What happened?
Andrea, I was under some pressure, boy. Well, I know Uncle have diabetes, high blood pressure, and poor circulation. He couldn't even walk properly yesterday, so I took him to the Feet Lady, boy, Dr. Anaya Tony. And let me tell you something, when they're done with him, he feels so good. You know the man forget he walking stick by them. When I go back for the next session, we'll get back, man.
I must send that number to my cousin. She have a pinched nerve, lupus, and I think she uncle got a stroke. I had to see about my back pain too.
Well, Andrea, what are you waiting for? Take these numbers down one time. 360-5166 and 478-7416. Dr. Anaya Tony, boy, the Feet Lady from Anaya Health and Wellness Center. You can't go wrong.
To the men who feel like you're at your wits' end, don't know how.
Welcome inside another edition of Men Talk. I'm ready to hand over to Professor. Professor, are you hearing me?
Good evening to Trinidad and Tobago, and of course beyond, because we are circling the globe. Right now we are on FBN TV, we are on Isaac The Promise Facebook page, and of course right here on Isaac 98.1 FM The Promise. So we welcome you to Men Talk, and I always believe that we all, even though we've been doing this for 16 plus years, I always believe that somebody new is joining us, and so I always like to start off by explaining what the program is about. It's a program where we have created a space for men to talk, simply that. For men to talk about issues that affect men. The purpose of the program is so that we would have better husbands, better brothers, better fathers, better sons, better uncles, better grandsons, grandfathers, better males in our society. And we know God has established the male as the head of the home, so that, once you fix the head, the rest of the body can fall in place. But if you cut off the head, then that's death. So we want to fix the head. That's what we're trying to do. But even though it's a program for men to talk, it's also a program for women to listen, and you also get a chance to contribute, ladies. But let me say this one thing. Our main rule that we have, now because the program is an interactive program where we have a discussion on a particular topic or topics, and then we open up the lines to take calls, questions, and comments. We ask that only the men call, please. Only. We take calls from men only. And the reason for that is because we want the men to talk. We have seen over the years when the women begin to talk, the men don't. The men keep quiet. And that is because men only talk in comfortable spaces where they feel comfortable. And we believe that once you have men together, that's a comfort zone for men. So we allow the men to talk. We don't allow the ladies to talk or to call in with their questions or comments. Now, we have a lot of ladies who are ardent listeners to the program, and I say that because they tell us that all the time. We do have a space for you ladies. It's just that we don't want you to talk. But you can communicate with us via WhatsApp. We have a WhatsApp number, and you could take it down right away. It's 275-1981, ladies. 275-1981. Send us a text message, not a voice note because you'll be talking. Text message and ask us a question, make a comment. Because a lot of times women say, we hear you men saying this and saying that and you're talking nonsense. No, that is not true. And they want to, they want to have their input. They want to tell us, they want to correct us, they want to straighten us out. So ladies, you have the opportunity to do that, but you have to be able to text. You have to be able to type, and we will acknowledge your text message. We will read it out and we will address it. So ladies, thank you. Men, we will give you the numbers to call in a short while, but ladies, you take that number down, 275-1981, and we will accommodate whatever questions or comments that you have. I have my co-host, and I can't see, so I am trusting that they're both there George Thomas, and Riquen Allen. The first one you address. George, are you here with us this evening?
Yes, good evening, Professor. Good evening, Trinidad and Tobago, and the world by extension. It's another Saturday. I'm here and ready to rumble on another mentor.
Wonderful, wonderful. Riquen, good evening. Are you here? Well, by the silence, I'm thinking he's not here. Is Riquen here? Can anyone see whether Riquen is here or not? Or is he
I think he's just coming in, Professor, so you got to give him about 5 minutes and he'll be in. Or less.
Okay, well, we will acknowledge.
Or less. He'll be in a few seconds.
Okay, a few seconds. So Riquen Allen is another one of the co-hosts of the program. Riquen, if you are in at the moment, just unmute and say hello to the folks, please.
A pleasant evening to everyone. And it's a pleasure to be here once again on this last day of April 2022. So thanks for having me.
Yes,
welcome to our guests.
Yes, indeed. Just before we welcome our guests, let me just say, in case she's listening, my one and only daughter celebrates her birthday today. So Nicole, yes, Nicole is my wife, and my daughter is also Nicole. Nicole, happy birthday to you, sweetheart. Daddy loves you, even though you're a big woman. I love you dearly, and I'm hugging you right now and kissing you. Nicole is my only of my children, the only one, the only female, and the only one that where I was there at the birth. I saw her come into this world. And that's why it's a special day for me as she celebrates her birthday as well. So happy birthday to you. Nicole Chapman. She's now Nicole Chapman, no longer Nicole Richards. So let's introduce our guests. Now, our guests, I asked him to send me his bio, and he did send it to me. And Doc, I don't know what I did with the bio, so you're going to have to help me with some of it. I remember a couple of it. Dr. Lexter Goetz, he was a founding member and first president of the Trinidad and Tobago Urological Society. President of the Trinidad and Tobago Medical Association. And Doc, tell me whatever else is there to be told, because I know you have other credits to your name, other thing behind your name, and I want people to know that we have a guest that is worth listening to. So I'm going to welcome you, first of all, to Men Talk on our station, and just introduce yourself, please. I know you are also the recipient of a national medal. So let's hear it from you. It's always nice when people can, song your trumpet, but for tonight, I'm asking you to share with us. Doc, good evening and welcome.
Thank you. Thank you for having me. Thank you for inviting me. Just one thing I would like to add to that is that when the three consultants in San Fernando were in their 50s, they realized that there was nobody to succeed us. So we decided we should approach the university for a training program to train the young doctors to become specialist urologists. And I think that is one of the important things in the development of urology in Trinidad. So we did start that program with the university, and today we have 12 consultant urologists who graduated. We still have some in training, but I was fortunate to be made the program director for the university at St. Augustine, and that has improved. What has also helped is with this training program, we were able to attract professors from the United States to come and do hands-on workshops in new technology that was not available in Trinidad, which we have now, things like laser surgery and so on. And they came down. We've done 38 workshops over the years, which has really improved the quality of urology in Trinidad. So that is what I don't want to go in. My CV is 40-something pages long, so I can't go there. I just want to hit on the training, and the training both from the local point and from the international and regional point that has really made a difference.
Wonderful. Thank you. So we welcome you. Thank you so much for consenting to be with us tonight and sharing some of your knowledge and your expertise. Let's start with the basic thing. Explain what is urology.
But urology is it studies two systems. It's a surgical specialty, so we do surgery. And the urinary system, even though I know you say it's men's talk, but women do have kidneys, they do have bladders, they do have a urethra. So we do see women as well, because sometimes the kidney has infections, the kidney has kidney stones or cancers of the kidney, and we have to operate. And then they get bladder infections, bladder cancers, and so on. So we have to treat that. So both men and women, as far as the urinary system is concerned, and what you have to understand with the urinary system is that the kidney produces urine, it travels down a tube called the ureter, stored in the bladder, and then passes out through the urethra. So that system is what, to any problem in that system, any problem that requires surgery, that is us. And the second system we deal with is the male genital system. And the male genital system, as you know, it consists of the testicles that makes the sperms that join with the fluid from the prostate and then passes down the urethra in the penis. So anything with the testicles, the prostate, or the penis is the male genital system, and that is the second system we do. So any problems with that require surgery, whether it's a cancer, an infection, or any other issue, would come to urology. So the urinary system and the male genital system.
Well, let's talk about some of the issues that. Let's deal with the males first. We could bring in the ladies along the way. Let's talk about the males first. Tell me some of the issues that that men have that you all have to deal with, some of the challenges.
Yeah, by far, the most common problem we have is a prostate problem, whether it's an enlarged prostate or a cancer or an infection of the prostate, followed by kidney stones. So you have, and that causes severe pain. So we do see a fair amount of kidney stones, and then problems, of course, with erection, and men who have low sperm counts, so they have difficulty having children. That is infertility. So these are the common things: infections in the bladder, cancers in the bladder, or anywhere in the system.
Okay, so for a long time we've been hearing about the prostate and how important it is, and men should get their prostate checked. Talk a little bit about that for me, please.
Well,
for men.
yeah, what we need to understand, why it has become important, is that we have a national cancer registry in Trinidad, which calculates how many cancers in each area. And prostate cancer has been consistently, they've been the #1 cancer in both in men at this point, at 20% of all the cancers. This is followed by breast cancer in women, which is 15%, and colon cancer in both men and women, which is 10%. So prostate is still leading at 20%, and that has been so for many, many years. And this is where the importance of the cancer comes in the fact that it is so common. Even though prostate cancer is the most common cancer, the most common condition of the prostate is not prostate cancer, it's the enlarged prostate that has no cancer. That is even more common than cancer. But of course, everybody worries more about cancer because of the potential for your life, to shorten your life expectancy. And I think from that point of view, the prostate itself became important when we realized, when I started urology, it was in 1985, we had nothing to cure prostate cancer. Everybody came when they had one foot in the grave, and we had very little or nothing to help those patients. Today, we have curative patients, and one of the patients I know we treated curatively in 1998 is still alive today, and that is 24 years. and he still comes to visit me. His PSA is still 0. So it is a curable condition, provided you catch it early. The danger with prostate cancer is that you could have a cancer and have absolutely no symptoms at all. And I think that is what this is why you have such a program, to alert people that you could be playing football, cricket, running up and down, winning marathons, and there's a cancer inside you and you don't even know, because you have no pain, no complaints, nothing, but it's a small cancer and it will grow. And this is why we recommend that people over the age of 40, which is when we see prostate cancer, should do their PSA blood test and do the digital rectal exam. Because you can, if you pick it up early, you get a perfect cure. And we have people now, the first guy we did curative surgery is now 24 years alive and well and walking faster than me.
Doc, you said, you know, there are sometimes those symptoms, but if there are symptoms, what are those symptoms that something is wrong?
Okay, by far the most common symptom is a urinary symptom, where people have difficulty starting. They have to force a bit to start to pass urine, because the bladder is squeezing out the urine, but the first place the urine goes to is in this little tunnel in the prostate. And it has to pass through that tunnel. And when that tunnel gets squeezed, as the prostate gets harder or larger, then the bladder has to work that much harder to squeeze out the urine. And it's like lifting weights. If you have a big, heavy weight, you strain to lift it, and then finally you lift it out, because your muscles are trying to overcome the resistance of the weight in the same way the bladder is trying to overcome the resistance of the prostate. So that is why you have to wait. They want to pass urine, but the bladder hasn't built up enough strength to squeeze out the urine against the resistance. So you have a little waiting and a little forcing to start. And when it does start, it comes slowly. You know, it doesn't come with a force as an 18-year-old. It comes slowly, and then the bladder might get tired. Just like if you're running a long distance race, you get tired, you stand up one spot, drink some water, and then you start again when you get a little more energy. The same way the bladder could stop and start. And people do complain of, we call it an intermittent stream. So you pass urine, then the bladder gets tired, nothing comes out, then it starts back again, then nothing comes out. Then. So it's a stop and start. And it's all about muscles. The bladder is a muscle, and the prostate is a muscle. So it's a muscle fighting a muscle. And this is the kind of symptom we start. And then when you finish, you feel as though the bladder gets tired, he gets fed up with all this trippiness, and he's exhausted. So you get this feeling, well, all didn't come out. They're still, and rightly, if you pass urine, all's supposed to come. You're not supposed to have anything remaining. And the people who have enlarged prostate, the amount of urine remains behind. And you get this feeling of what you call an incomplete emptying. Something has remained. So it's like you start off with forcing and hesitancy, then it's slow, then it's intermittent, and then you feel incomplete emptying. And the other 3 symptoms that people get would be frequency, going very often to pass urine, urgency, you have to get there right away, you can't hold it, and sometimes it might come down before you reach the toilet, and getting up at night. You go to bed, and you have to get up to pass urine, the bladder is full. Then you go back to sleep, then you get up again. And that's called nocturia. And many people, after we treat them and things have improved, they'll come back and tell you, Doc, I could finally complete my dream. Because they start dreaming, and then they have to get up and pass urine, and they can't get back the dream that they were, the nice dream that they were getting. So that is nocturia, and that is a major concern with most people. They would like to get a good night's sleep, so they won't feel exhausted in the morning. They'll be refreshed, and they will be ready to get up and go. So these are some of the early signs. The most common signs would be urinary sign, and then that would point you in that direction to check. The more advanced signs would be things like weight loss or loss of appetite. I saw somebody today, and he's lost so much weight, the pants just falls off. No appetite, doesn't feel like eating. And with most cancers, When they reach a fairly advanced stage, those are not just prostate, but other cancers, loss of appetite, loss of weight. Sometimes if the cancer is spread outside of the prostate and it goes to the spine, they may get back pain. So you see people coming with back pain and then you track it back down to the prostate. Sometimes the back pain presses on the nerves, the cancer presses on the nerves, and they get weakness of the lower limb. Sometimes they become paralyzed. Those were the kind of cases we saw very commonly years ago before people knew much about prostate cancer. If it spreads to the glands, the lymph nodes inside the pelvis, you may get one leg swollen. So somebody will come and say, look, this leg is swollen, but it really is the gland blocking the flow of blood from the legs, and that you trace it back and it goes back to the prostate. Yeah. So these are some of the symptoms that we see. Yes.
Folks, if you've just joined us, you're listening to Men Talk on Isaac 98.1 FM on FBN TV or YouTube channel and Isaac the Promise Facebook page. In studio, we have Riquen, Alan, George Thomas, my two co-hosts. You know, and I almost always never introduce myself because I keep thinking everybody knows who I am. My name is Noel Richards, known to most people as the professor. And that's who I am, just in case you're new and you want to know who is this talking here. We also want to say thank you to our sponsor, Naya Tony, the reflexology lady. Thank you so much for your sponsorship of the program. Our guest today is Dr. Lester Goetz, and he's a urologist, and we are talking about prostate. The thing that a lot of men fear, this whole, it's your prostate. You say prostate and men go scampering because, you know, it's a big thing. It's a big thing. And like most men, doc, it seems that we don't want to know if something is wrong. We don't want to find out. And that's the reason why a lot of men do not go to doctors. And even though they may be seeing the symptoms, they try to tell themselves maybe something else, so it's not that bad. But how do you know how, okay, let me back up a little bit. The PSA, I know, gives a, it tells you that something is wrong. So tell us a little bit about the PSA, what it is, and what the readings are supposed to be.
Okay, well, PSA means prostate-specific antigen. It's a blood test, and everybody has prostate cells produce PSA, but if there's a cancer, it produces more PSA. The cancer cells produce a lot more. So your normal reading would be less than 4, and it's dependent on your age. Somebody in their 50s, we'd expect a PSA to be 2, in their 60s, 3, and their 70s, 4. You know, so we look at the age of the patient, and we also look at the size of the prostate. The normal size is 20, but as the prostate gets larger, the PSA the blood reading gets higher. And therefore, PSA could be indicative of your age or the size of the prostate. Sometimes it's due to an infection. But the one thing we're interested in, if the PSA is greater than what it's supposed to be, is there cancer hiding inside of the prostate? And we don't know. So we depend heavily on the PSA. And if we've got a cure for prostate cancer, then that PSA should be 0. The surgery should be 0.2, it should be 0.5 for radiation, but it should start with a 0. So even a PSA of 1 would be too high, 2 would be too high. But for somebody who doesn't have a cancer, we expect the PSA to be less than or equal to 4. So that is, the PSA is a good marker of prior to treating cancer, to help us to detect cancer. And once the PSA is elevated and we are suspicious, we also do a rectal exam and we feel for a little lump or a hard area, what we call a nodule in the prostate. So a little nodule, say, okay, or a rough area. Your prostate is supposed to feel like your nose, soft and smooth and spongy. It shouldn't be hard or rough or irregular. So the examination gives us an idea, is this a suspicious gland, is it not? And we combine the PSA with the texture of the prostate to give us a clue as to whether this could be a cancer. And if we suspect enough, then the next step is to do a biopsy. And a biopsy is a painless procedure. We do give local anesthetic to numb it, and we use an ultrasound to see where we are doing the biopsy. We take 6 tiny, tiny pieces from the right side of the prostate and 6 from the left side. And we put them in different bottles to find out where is there cancer, first of all, and where is the cancer. So those samples go for testing, they look under the microscope, and the person, the pathologist who is looking at the microscope will not only tell us if there's a cancer, but will give us an idea of how fast the cancer is growing. Is it a slow cancer? Is it slow growing, which is like a grade 6, intermediate growth, which is like a 7, and a high-risk cancer, which is 8, 9, and 10. So we get an idea, okay, you know, what is going on inside the prostate. Not that only that it's a cancer, but how fast it is growing. And then if we say, okay, there's a cancer there, we want to know if the cancer has left the prostate and has it gone outside to the bones or the lymph nodes. And to find that out, that is called staging now. We want to know, is it only in the prostate or has it left the prostate? We would do a bone scan to look for bones, any bony spread in, that may be there. They may have back pain, but it may be a small cancer and they may not have yet started to get back pain. And the other thing we do is a CT scan. A CT scan is looking for the glands in the pelvis, the lymph nodes, which is the second place that the cancer spreads to. So those 2 places, the bones and the lymph nodes, and we assess it with a bone scan and a CT scan. And if it is only in the prostate, then there's a very good chance of a cure. Even if the PSA is very high, we're getting people with good cure rates with high-risk prostate cancer, but localized. It hasn't spread, so we call it non-metastatic. Spread is called metastases, and if it hasn't spread, it's non-metastatic. And we're catching people who with high risk, even though it's high risk, high PSA, high grade on the microscopy, but it has not spread outside, and they are getting excellent cure rates with treatment. Wonderful. I know you wanted me to say, we're going ahead of ourselves. You wanted me to say, what does the prostate do? I know you're going to ask that. I think
let's go. Let's
we should have started at that point. The thing about the prostate, it's a small gland that you can't see with your eyes. You really can't see it. It's pretty small. It's small like a walnut that you get at Christmas before you crack it open. And you can't feel it because you can't see it, but you could feel it by putting a finger into the rectum, and it's right there, just at the exit. You could feel the soft, smooth gland, that is the normal gland, and you want to know what it does. Why do we have a prostate? Well, many people think it has to do with erections, but it doesn't. That concept came because the nerves for erection pass just outside of the prostate. It's not part of the prostate, but it's close by. The prostate job is reproduction. The prostate is to have babies. So if you don't have a prostate, you can't have children. The reason being the prostate produces this fluid called seminal fluid, which is the ejaculate. When you have intercourse, that discharge that comes out is coming from the prostate. And that is important because when the sperms join up with that discharge, and the sperms are coming from the testicles, and they travel up and meet the prostate fluid, the fluid provides energy. It has fructose in it, which gives energy to the sperms to swim. Otherwise, the sperm cannot swim. The tail won't move without some energy. You know, it's like you've given it some sugar to swim. So if you don't have that ejaculate, the sperms are not going to make it all the way to the egg. And so that whole purpose of the prostate is for reproduction, is to have children. It produces the ejaculate. Yes.
Yes, indeed. I want to ask my co-hosts and they, if they have anything to add or any questions to ask. You could jump in here or jump in at any time. Perhaps you could just put up your hand so that I can see and acknowledge you, both Riquen and George. So I don't know if at this time either of you would have anything you want to add or ask Dr. Goetz at this particular time, gentlemen.
We have them speechless. They're speechless. They can't talk.
Oh.
If they can't ask, I'll go on a little further to tell you that the symptoms I gave you is part of what we call the IPSS score, International Prostate Symptom. And that is classified into mild, moderate, and severe, depending on the result you get. And if it is mild, the symptoms are mild, like the frequency and urgency and getting up at night is in the mild range, then you could actually help that patient without medication. You could say, okay, at night, I don't want you to drink any fluids for 2 hours before you go to bed, so that you don't have to keep getting up to pass urine. Secondly, I'll try to reduce the caffeine. So if you drink a lot of Lipton tea, coffee, Lucozade, Gatorade, Red Bull, stuff that has caffeine in it, it will produce a lot of urine and you'll have to keep getting up to pass urine. So no caffeine at night, and no alcohol at night, because alcohol is also a diuretic. If you want to drink wine, beers, scotch, make up your mind to get up and pass urine whole night, right? So we reduce caffeine, we reduce alcohol, and reduce any kind of fluid, even water, for 2 hours before. So you need to know what is your bedtime and nothing at all to drink for 2 hours. And that is called a lifestyle change. So we try to modify the lifestyle, and they sleep a lot better. You know, people are getting up all night and you say, okay, well, stop the wine that you're drinking at night and you'll sleep better. And they do sleep a lot better. If it is, that is it for mild symptoms. For moderate symptoms, we give tablets. And the tablets are to relax the muscles of the prostate and open out that passageway so that the urine completely empties. When the bladder squeezes out the urine, it has a free flow because the muscles in the prostate relax and open out widely. And those are called alpha blockers. A lot of people know them because things like Flomax, tamsulosin, terazosin, Silotrip, all these are on the market. They all do the same thing by relaxing the prostate muscles, opening out the passageway to let the urine. However, they don't shrink the prostate. So if people have an enlarged prostate greater than 40 cc, then they have to add another tablet to shrink the gland, which is called a 5-ARI, like Avodat or Duodat, and that will help to shrink the gland. So that is for the intermediate risk, intermediate symptoms. They're not mild anymore, they're a little more severe. And for the severe symptoms, where the score is greater than 20, we usually recommend some sort of intervention, surgical intervention. So long ago, everybody had to have open surgery. But in 1981, there was an introduction into Trinidad, both at Port of Spain and San Fernando Hospital, of a telescope to remove that swelling in the center of the prostate. And that is known as a TURP, which we still do today. And then came in 2019 the HOLEP laser, holmium laser, where you enucleate, you remove the entire prostate with a laser. And then recently in March this year, we got the green light laser, which is a more powerful laser, and that vaporizes the prostate. So you could see the development over the years with different techniques. So at the end of the day, the whole aim is to widen that passage in the prostate so that your urine flows freely. These are not cancer operations. These are operations to help you to pass urine. You get up less at night. You don't have to go so often and no forcing. Your stream is no longer slow. You completely empty your bladder. And there are a lot of rewards with these kinds of operations. Most of them will take about an hour to do. And we don't usually put patients to sleep. They go under regional anesthetic, so they don't have any pain. And the majority of people can go home the next day. With the green light laser, which is the latest one, they could go home the same day because there's little or no bleeding and the patients are up and about very quickly.
Wonderful. George, I see your hand, but just before I bring in George, you said the green light laser, it vaporizes the prostate. That means it gets rid of it totally. Is that what you're saying?
Well, it's getting rid of the... If you're going to try to get rid of a prostate totally, it means you are doing an operation for cancer. where you're operating from the outside of the prostate, where you're taking out the shell where a lot of the cancers are, which is on the outside, the capsule, which is on the outside. But with an enlarged prostate that is causing problems, then we are operating on the inside. So we do leave back the capsule, and there is a bit of prostate. So even after you finish with all these procedures, you should still be measuring your PSA at least once a year. For the older people, we say once in 6 months, just to make sure that no cancer develops some years down the line.
Indeed. George, you had a question or comment?
Yes, definitely. I can reliably assure you, doctor, that I won't be getting much sleep tonight after hearing all of this. But I do have a question.
Yes.
You see, because now I've come to understand a lot of the symptoms of someone who is diabetic. And one of the overlapping symptoms that I've identified is the increase in going to the bathroom and that sort of thing. So is it that it is something pertinent that a man should look at once he's going to that bathroom overnight or more frequently than he
Sure.
usually would have? Is it pertinent for him to still pursue an examination as to whether or not it may be a prostate issue, even though he may understand his diabetic status?
Yes, that is an excellent question. And that is the reason when somebody comes to us with these urinary symptoms, we don't only think of prostate, but we do look for uncontrolled. There are many things that give you the same symptoms. Uncontrolled diabetes is definitely one where you get frequency, urgency, nocturia, and that is one of the tests we have to do. We must do a HbA1c, which is the 3-month average of the sugar. We test the urine because an infection in the bladder can give you those same symptoms. So we look for bacteria. We do an ultrasound to look for stones and an x-ray because stones in the bladder can give you the same symptoms and it's not your prostate. And also cancers of the bladder could irritate. Anything that irritates the bladder could give you those identical symptoms. So we are looking at prostate, but we are looking at any other, what we call a differential diagnosis, any other problem, and diabetes is one. I have had people with terrible urinary symptoms and sent to me and, dear Dr. Goetz, kindly see this man with a prostate problem. And when I do the sugar is sky high. There's sugar in the urine, there's sugar in the blood, there's sugar everywhere. And once you control the diabetes, the symptoms go away. You know, and the person is perfectly fine and they never had a prostate problem in the first place. He did have uncontrolled diabetes. So that's a very good question. What you're going into is another aspect that I didn't talk about yet, which is the differential diagnosis of all the things that can cause these identical symptoms. Yeah.
Thank you. Anything else, George? Riquen, at this time?
That's a very good thing. Then after we've examined the prostate, then we want to do some tests. We want to do what is called a flow test, where you pass the urine into a little computer and a long graph will come out. Now, a normal flow test is like a little mountain. It goes up and down. But if there's a restriction, it no longer goes up and down, it goes across. And sometimes there's a narrowing in the penis, which we call a stricture from a previous infection. And it's really, really flat. It's a flat curve. So we are looking at the shape of the curve to give us an idea if there's a bladder outlet obstruction. Is this prostate truly obstructed or is there another problem? So the flow test, we ask patients to drink 4 glasses of liquid and pass urine into the computer. It's very easy, but it's very important and gives us an accurate idea of what is really going on. The other thing we do is a rectal ultrasound, which is the most accurate way to look at the size of the prostate. So we measure length by breadth by height, and if the prostate is less than 40, it's a different treatment from if the prostate is greater than 40. As we said, Less than 40, we could give an alpha blocker. Greater than 40, we have to add medication to shrink the gland. So the size of the gland gives us a clue as to what type of treatment there is in addition to the flow test. So we depend on those two. Now, there are absolute indications for surgery, and one is stones in the bladder, but you can't, or no tablet is going to melt those stones in the bladder. We do have to shatter them with the same telescope that you're using to remove the blockage. So bladder stones, if the person is in kidney failure, which means the pressure in the bladder is so high from the obstruction, it goes all the way up to the kidneys and the kidneys swell up. So if you have these swollen kidneys, that's an absolute indication for you to do surgery rather than tablets. If the person has recurrent infection, that means a lot of stale urine, despite the tablets, a lot of stale urine remaining after they fast urine, they need to have surgery. So these are some absolute. If the person is in retention, that means they can't pass urine at all, and you have to put a catheter in, and then you take it out and they still can't pass urine, then you have to do some surgical intervention. So we have some absolute indications, you know, stones, recurrent infection, kidney failure, retention. And that will say, look, this patient, the tablets are not going to work. We have to intervene and do something to help that person on a permanent basis.
Wonderful. Folks, if you just joined us, again, this is Men Talk on Isaac 98.1 FM. We are live. You can see us as well as listen to us on FBN TV. That's our YouTube channel. You can also find us on Facebook at Isaac the Promise. That's our Facebook page. And we want to let you know in the studio, well, in the platform tonight, we have Riquen Allen, George Thomas, myself, Noel, Professor Richards, and our guest, Dr. Lester Goetz. George, I see, I don't know if your hand is still up or if it's up again. So, the floor, George.
Thank you so much. Doctor, I mean, there's so much wonderful information that you are giving. I mean, my head is giddy, being wrapped around all of the information that you're giving. To the layman, to the person that's home that may be seeing certain symptoms, you know, perhaps the color of their urine being discolored, or they're getting pain during urination, and that tired bladder effect. Are there any household solutions or practices that we can implement as men in our lives from home that would be able to help protect us against, you know, further advancement of these types of symptoms and you know, this disease?
All right. The thing about prostate cancer, it has a strong genetic component. You know, when I first started, they thought it was 10%, but today they found over 50% of prostate cancer genes are transmitted. So once somebody has prostate cancer, we worry about their brothers, we worry about their sons, and we usually recommend that they start testing at age 40. But what we do know for sure is that reduction in the amount of meat does make a difference, because the Japanese right now have the lowest prostate cancer. And for years, the scientists couldn't figure out, when the same Japanese go to America, that they are getting prostate cancer. And why is the twin brother in Japan with no cancer and the identical twin goes to America and he gets prostate cancer? And it took the scientists a long time. They tested everything. They tested the air, the water, the soil. They couldn't figure it out until somebody said, why we don't check the diet? And the Japanese live on fish. They eat sushi, right? And they didn't know that the fish was protecting them from prostate cancer. They just eat fish. We eat doubles and we eat palau. We don't test it. We just eat it. That's what we eat in Trinidad. They eat fish in Japan. But when they reach America, they said, we are in America. Let's eat American food. So they threw away the fish and they started with American food, which is bacon in the morning, KFC lunchtime, steak in the night, hot dog, hamburger, salami, beef, pork, goat, duck, clam, chicken, and no fish at all. And then when they tested the meat, They found that the meat had animal fat. If you took a chicken breast and put it in a George Foreman grill, look at the pan underneath and you'll see the amount of grease and oil. That is what stirs up the prostate cancer. That the fish, so that's the animal fat, but the fish had omega-3, and it's the omega-3 and that stops the cancer. And we normally add omega-3, not omega-3, 6 and 9. The 6 is not good for the prostate, the pure omega-3. And you'll remember it because there were 3 wise men that came to visit Jesus when he was born, and there were 3 crosses when he died. So 3 is an important number, and you could remember pure omega-3, which is what the fish has, particularly oily fish like salmon, tuna, herring, mackerel, sardine. The fish is a protection against prostate cancer. And the other things that they have tested, like tomatoes, broccoli, soya, watermelon, pawpaw, olive oil, and recently pepper. They found pepper has a substance called capsaicin in it, which prevents prostate cancer. So your diet becomes important. And Jesus knew that 2,000 years ago because he fed his disciples with 5 loaves of bread and 2 KFC. You remember that?
I don't think KFC was there. The fish.
Right, so he gave them fish. He didn't want them to get prostate cancer. So Jesus knew that, and it took 2,000 years before the scientists proved that Jesus was right all along. You know, we are a bit slow. We read the Bible, but we don't believe it. But it's all there. All the answers are right there. And therefore, changing the diet and moving away from the meats, the things that walk on the ground, stay away from that, and increase the things that swim in the sea. And that does make a difference in terms of prostate cancer. Definitely the diet has shown over and over to be important. And even if somebody has prostate cancer, we still change the diet to reduce recurrence rates after treatment and so on. So that is what you can definitely do in terms of your diet, yes. Good question. Important.
Yes, George. George, understand again? George, you have another question?
I'm trying to find all that I can do to prevent this because at the end of the day, I enjoy life and I enjoy health, you know, so I'm going to try to ask as many questions as I possibly can. Doc, are you suggesting fish? I know that a number of men would have raised their eyebrows because they're thinking, ah, boy, I knew that there was some good thing in me eating clams and eating conchs and shellfish and whatever and stuff. Are these things just as well good or not good for men to consume? Because I know a number of men right now, they would be going by the man for oysters and saying that this is thing for the prostate.
Well, the oyster is an aphrodisiac. There's no evidence that oyster helps with the prostate. The things that have fins that swim in the sea, they have a tail and they have fins. The fish itself, not the oyster, is to increase your desire to have intercourse. It is more like that, not so much for the prostate. But they are doing more and more tests, and this is how they got to find out how important broccoli is and tomatoes, and the latest thing is the pepper that has capsaicin in it. Yeah.
Indeed. Doctor, let me ask you one question. Is there anything you can say to men? One of the things that men are very, very scared. Let me use the word scared. They're scared about is that digital exam.
Right.
Men avoid it like the plague.
Yes.
Is there any way, what can you say to them to encourage men?
Well, it depends on who does the digital exam. So I do get complaints of people having had digital exams, and it is distressing. But then they come by me, and for some reason they don't feel anything at all. They usually say, "Doc, you finished already?" Some of them chatting on their cell phone while we're doing the digital exam. It's a technique, and it has to be taught, and you have to have training in it. And people like myself, like urologists, who do 5, 6, 7 digital rectal exams every day of the week. After time, you get really good at it, and should be absolutely no pain at all. because it's a gentle exam. It's light pressure, and it should be done very, very slowly and gently. And most people would finish a digital rectal exam in seconds, literally take seconds to pick up if there is something abnormal in the prostate. You're looking for something that feels like your nose, soft and smooth. Anything that is not soft and smooth, you start to worry. If it's hard like rock, or rough or irregular like sandpaper, or there's a hard lump, you'll feel it right away. The gland is a small gland. You feel it in seconds, literally seconds. So it's quite painless. But I would recommend if somebody wants to have a rectal exam, they should seek a urologist, somebody who does a lot of this every day until they're so good at it. You don't know. You don't feel anything.
Indeed. Doc, I want to...
You don't become homosexual, I agree. I can tell you.
Yeah, and that is what, and that's the thing. Yeah, a lot of people, they say that, and I think it's just out of fear.
But when they have a bowel action, what comes out is much smaller than my tiny finger. So, it's...
I hear you. So I'm hoping that the men out there, feel a little more relieved, in terms of those who have to go and do this exam.
Professor, Professor, we have some
Okay.
WhatsApp messages. You like to take it at this time?
Yes, sure. Go ahead.
All right. One of the messages says, can an enlarged prostate cause a hernia? If so, how?
Well, it's not, doesn't cause the hernia, but it can make a hernia operation. It could make the hernia recur. The reason is a hernia, well, if you have a hernia, when you cough or sneeze or increase the abdominal pressure, then it bulges out. So most people with a hernia will say, look, if I lift anything heavy, I cough, sneeze, this thing swells up. And when I lie down, it goes back in. So it's what it's called reducible. That is what a hernia is. So the increase in abdominal pressure pushes out the hernia. Now, if somebody is forcing to pass urine, that is increasing the abdominal. It doesn't cause a hernia, but nobody will operate on a hernia unless the urologist removes the obstruction first, so that there's no pressure, no high pressure to force, or the urine comes out freely under low pressure, and therefore then the surgeon will say, okay, I can now do the hernia operation once the prostate obstruction is relieved. Otherwise, if you go the other way and you do the prostate, you do the hernia, and then you're still forcing to pass urine, that hernia will recur. So they're quite right. There is a link with increased abdominal pressure, forcing to pass urine. That same increased abdominal pressure will cause the hernia to recur.
Wonderful. Any more questions on so long?
Yes, we have another question here. Somebody says, good evening, gentlemen. My father was diagnosed with prostate cancer a couple years ago. He is now 85 years old, and I have noticed that within the last year, he has lost a lot of weight. His appetite fluctuates. At his age, would the cancer spread?
Oh, yes. Cancer could spread at any age. Yes, of course it can. And if he has lost appetite, that is worth investigating. If it is due to prostate cancer, other cancers can cause it. Colon cancer is right after prostate. So with men, prostate first, colon second. So a colon cancer can cause that as well. So once somebody is losing weight, that person needs to have investigation into the weight loss. Yeah, sometimes it's an overactive thyroid would cause you to lose weight. But definitely the most important thing is to rule out a cancer that can be treated.
Wonderful. Adesola?
Let me just hold on. One of the messages is still kind of coming in. Can a young person under 40 years old have symptoms or have issues with prostate?
Yes. In fact, the majority of people we see with what we call prostatitis would be young people. What is happening here, this prostate condition is related to stress. And many young people, they're trying to get an education, they're trying to pay off a car, pay off a house, they are trying to get their marriage sorted out. little children to see about, and or businessmen who have deadlines. They have to do this by tomorrow. They have to do that by next week. There's a lot of anxiety. We see that happening a lot of the time. People who are rushed and anxious and stressed, the muscles of the prostate tighten. They get very, very tight. And you would not see it in old people because they already pay off for their house and all they're doing is playing with grandchildren. They don't have to go to work. So you don't see it in the older folks. That happens in young people. That's called prostatitis, where the muscles of the prostate are tight. You will see that on a flow test, and that leads to pain, discomfort in the genital area, testicles, penis, suprapubic area. They get this pain. And once you deal with the muscles being tight, and we give them muscle relaxants, but we also have to deal with the stress. And I usually recommend a book called How to Stop Worrying and Start Living by Dale Carnegie. That seems to work very well. But then sometimes they have to go to clinical psychologists to do relaxation therapy, stress therapy, and that works really, really well. So prostatitis, yes, indeed, does occur mainly in younger people due to their high stress life, and they don't know how to cope with the stresses.
Yeah, wonderful. Before we take the next one about the soul, I see Riquen hand is up, so I want to go to Riquen at this time.
Oh, good evening. Great session so far. Lots of information. One of the challenges that we deal with as men is the whole stigma of the prostate exam and so on. And when we look at our female counterparts, with them doing their annual pap smears and the breast exam and so on, the stigma seems to be a whole lot less, right? In addition to which, they seem to have a more of a community type response, when it comes to their reproductive health and so on. How can we as men deal with the stigma to be more proactive when it comes to our own health?
I think the only thing that we can do is to educate. I think that is the best thing you could do, to let them know that this is a common problem. They're not the only people in the world. There are thousands of people with the same problem. And many times patients come because of the wives. The wife insists you have to go and see the urologist. You reach the age now, go check it. No dinner for you tonight. Whatever it is, whatever threats the wives give, the men do come. But certainly education, because there's a lot of misinformation and people make up stories, neighbors, friends, family, and put fear into you, which is so unnecessary, because most of the time, the patients who've actually had an exam, they say, but that is it? I say, so what you thought it was, They want to know how you finished so quick and how they didn't feel any pain at all. So it is a very common problem, but it's an important way to assess the prostate. And I think the only way to get around this is through education, not just educating fellow doctors, but educating the patients and letting them know the truth and not all these Nancy stories that people make out. So what I would certainly advise is, if you wish to do a rectal exam, please go to somebody who does a lot of it, which is likely to be a urologist who has a lot of experience and would be gentle and quick and pick up anything right away,
Thank you. Okay, we're going to open up the lines just
okay,
about
so
now, but just
before you continue, could I mention something else that we didn't mention? We sort of overlooked that, which was sometimes a person has a elevated PSA, but we don't feel anything on the rectal. It feels normal. There's a new test that has come out, which is quite good, which is called the MPMRI, multi-parametric MRI, which is new to Trinidad. We've had it just in the last few years. And what that does, that picks up suspicious areas in the prostate that we can't feel with the rectal exam. So, and it will tell you if it is something significant or not. So it's called multiparametric, and there's a grading which we call the PIRADS grading. So if it is a grade 4 or 5, PIRADS 4 or PIRADS 5, that is very significant and likely to be cancer and would lead you on to doing a biopsy. And it will tell you which part of the prostate is the cancer. Is it on the right side? Is it on the left? Is it at the apex? Is it at the base? If it's PIRADS 1 and 2, it's not a cancer. 3 is sort of in between, but 4 and 5 is highly likely to be a cancer. So this MRI, even though the PSA might be up, guides us as to who may not need a biopsy, and we do far less biopsies with that guidance because we get PIRADS 1 or 2, which is say definitely not a cancer. It could be an infection that caused the PSA or just a big prostate. So it's a great guide, and we have it now available in Trinidad, the FPMRI for elevated PSA, that you can't feel anything with the rectal. It feels normal. But if you do feel a nodule, then you should go on and biopsy that nodule and the rest of the prostate as well. So I think the tools that we have today are much better, and we are picking up a lot of curative patients, which we couldn't see before. Nobody was curative. Everybody came advanced, it spread to the bones. We don't want to see, we hardly see that anymore, because I think most men are a little more aggressive with their health. They want to live, and people are living over 20 years now. They don't have to live 2 years. Like before, your lifespan was 2 years. It's too late. You should be living 20 more years and not dying from prostate cancer. You probably have to die from some crime committer and not from prostate cancer. Definitely. Yeah, if you catch it early, you will live a good, healthy life without having to worry about that.
I'm glad you said that. I think that would have put a lot of men at ease. But let me just quickly, before we open up the lines, touch on one thing that we haven't thought, we just mentioned, but I know the men would be listening to hear, and that's erectile dysfunction. What's the relation between the prostate and erectile dysfunction? Because a lot of men feel once you have a prostate problem, you have erectile dysfunction, or vice versa. If you have ED, then it has to do with the prostate. Then they don't want to have anything to do with it because it will get worse. So if you touch the prostate, as far as they're concerned, it's now you're in trouble. So I wanted to explain that for us, please.
Right. So the nerves for erection pass on the outside of the prostate. Most of these patients who we have an enlarged prostate without cancer, we don't operate on the outside. We operate on the inside of the prostate. So the chances are they will not have that problem from dealing with the enlarged prostate, because the operation is away from the nerves which are on the outside. However, if you do radical surgery, radical prostatectomy, or if there is radiation to the pelvis, that can affect the nerves. Usually 50% would have good erections afterwards, and 50% would have a reduction in the erection. So it's a half and half if they've had radiation treatment or radical surgery. It depends, and many people still get away with it and they performing. For instance, what we have now to treat prostate cancer is brachytherapy, where we put seeds into the prostate, so it's inside the prostate rather than outside, where the nerves are on the outside, and most of them would have good erections afterwards. So there are different kinds of treatments, The problem with the prostate and erection is sometimes if the prostate is advanced, you have to give hormone treatments, and the hormone treatment reduces the testosterone, and that could give you a decrease in desire to have sex. So it could affect the erections. So this is where the story goes with prostate and erections, is that the treatment for prostate cancer can affect the erections, yes. But there are ways to get around that. So we've had different people with prostate cancer, and they are getting perfectly good erections with treatment. Now, if the nerves are affected, then the tablets for erections don't work, like Viagra, Cialis, and Levitra, because those depend on the nerves for their function. So if the nerves are cut or injured, they don't work. But if we could treat just the blood flow, increase the blood flow to the penis, then they'll get a good erection. So many times we could do that with a liquid called Trimix, which increases the blood flow. So even if they can't get any erection after treatment, then they get perfectly good erections with treatment, with the Trimix treatment. So there's always a way to help a patient. So I would say the majority of people we have who had problems after treatment can get good erections after.
Yeah, well, I hear a lot of men clapping and feeling good at this particular time, because that has been a problem, with men. When you mention prostate or prostate cancer or prostate enlargement, they somehow associated that with erectile dysfunction, not be able to function or perform. And then you've heard so many times that once you have prostate surgery, that's it for you. Your life is over as a man.
No, that is not true at all.
Well, that's
and it depends on the kind of surgery, and then it depends on the follow-up after surgery to check for the erections and to give the appropriate treatment so that they can have sex again. The whole thing is you would like people to have intercourse simply because it's good for family life. You probably reduce the amount of domestic abuse if the person is performing well. And so we are very keen to help people with their problems with erection, because that extends onto the whole society. If the family unit is strong, then the society becomes stronger. So, and we really have to focus on the erection. The problem with erectile dysfunction, erections are based on blood flow to the penis. You know, if the blood is flowing freely, then you get a good erection. But if there's a sluggish blood flow, something is blocking the flow of blood to the penis, then the erection is not hard enough, it's lost easily. So our job is to try and find what are the things that would reduce the blood flow to the penis. And there are a number of risk factors. And the problem with treating erection is that people are not looking for the risk factors. And the risk factors are common diseases that we have in Trinidad. For instance, high cholesterol. We looked at that. We looked at over 100 people with erection problems, and the majority had high cholesterol. That is so easy to treat. And we could go into that in a little more detail. For instance, if it is a triglyceride, we could treat that with niacin and omega-3. We could also ask people to reduce their meat intake, and the triglyceride would come down, so you get a better flow of blood into the penis. If it's the LDL, which is the bad cholesterol, that is easy to treat with a statin. Diabetes is the other big issue, because diabetes does affect the blood flow to the penis. And so patients need to have tight control on their diabetes, and sometimes we have to add medication to what they have. So we do run cholesterol tests, we do run diabetic tests. If somebody comes with an erection, we try to find why are they having this problem. And there's no sense I giving you a tablet and I'm ignoring the cause of the problem. And therefore we recommend patients to reduce their flour. They like a lot of roti and bread and doubles and so on, and the sugar goes up and up, and that affects the erection. So in controlling their diabetes with strict medication, but also diabetic control with their diet, and encouraging diabetics to drink more water, reduce all their juice and soft drinks, which send up alcohol, sends up the sugar, So once they are conscious of their diet, then they get better control on the diabetes, they get better erections. High blood pressure is the third one. And high blood pressure, a lot of people walking around with high blood pressure, they don't even know, because they have no pain, they have no headache, no neck pain, nothing. But the pressure is high, and that pressure you can visualize is like a hammer pounding on your penis. Just visualize this pressure, but you have no pain. So the pressure leads to atherosclerosis, which is like plaques in the penis, in the artery, bringing the blood and blocks off that blood flow. So control of the blood pressure, reducing the salt in the diet, and there's salt in everything. People with high blood pressure eating too much chana full of salt, salt nuts full of salt, fries full of salt, popcorn has salt, corn kernels has salt. So the salt sends up the pressure, difficult to control if they're eating all the salt, and therefore the salt is sending the pressure up and leading to erection problems. So visualize every time you eat all that salt that you're having problems with erections. So controlling that blood pressure is critical. So patients need to purchase a blood pressure monitor. The top figure should be less than 140. And once they have that number in their head, they come in with pressures of 190, 200, 210, nowhere near to 140. And that high blood pressure is the cause of the problems with erection. Thyroid, overactive thyroid. So we have to test for the thyroid. If it's overactive, it's a risk factor. It's associated with erections. We do the PSA because we know prostate cancer can press on the nerves for erection. And we look at their testosterone because a low testosterone, it should not be lower than 300. We can give you testosterone treatment, which will bring back up the testosterone and help to improve the erection. And smoking, a lot of people are smoking, but they don't know that the smoking narrows the blood flow to the penis, and eventually they have erection problems. So people are smoking, we try to encourage them to stop smoking if they want to get a better erection. So there are risk factors, and so if we could go through it and we could help the patients, you know, cholesterol, diabetes, high blood pressure, thyroid, prostate cancer, testosterone, smoking, and you go through it one by one. Because all these risk factors, if the person has erection problem, it's the same blood supply that goes to the heart, same blood supply that goes to the brain. So, but the first one the patient complains of is erection, because that's the smallest artery and that's the one that gets blocked first. But it's a warning that the bigger arteries, like the ones to your heart, the coronary arteries, can get blocked and lead to heart attacks. And the bigger arteries, which are the carotid, going to the brain, can lead to a stroke. So the warning, erection is a warning that you are at risk of heart attacks and stroke. But the first thing that presents is usually difficulty getting a hard enough erection and maintaining or keeping that erection during intercourse.
And folks, we want to open the lines quickly.
Am I saying too much?
No, not at all, not at all. We need to hear these things. Folks, if you want to get in contact with us, if you want to ask Doc a question, we don't have much more time, but the numbers are 480-4121, 480-4121, and 463-7208. 463-7208. Let me see those numbers again. 480-4121. And 463-7208. You have a question. Remember, this is just for the men. Ladies, you can continue to send your WhatsApp messages to 275-1981. We only have a few more minutes, so
Professor,
call now or send the question now. Yes.
Taking a call. Hello, good evening.
Yeah, hello, good afternoon.
Hi.
I'm 48 years, right? But I was just diagnosed with my posture just went up to like 8 psi. And well, my father, he had passed away like about 3 years ago. So I wonder what is the risk factor for me also.
But what was the PSA reading?
It's reading 8.
8, and you're in your 40s?
I'm 48, yeah.
Yeah, well, for your age, your PSA should read 1. If it reads 8, then you do need to get a digital rectal exam to see if there's anything suspicious. I mean, a high PSA, as we said, doesn't always mean cancer. It could be prostatitis, it could be an enlarged prostate. So it needs to be investigated. If it is a cancer and it's 8, it means you are in the range where you could get a complete cure. Because once the PSA is less than 10, you get a very good cure rate. So it should be something, you shouldn't wait and wait. You should go to see a urologist and get it sorted out urgently, because you are in range to get a good cure.
And where are you located at?
I am, well, in North, I'm in Medical Associates with St. Joseph Hospital, Medical Associates Hospital. In South, I'm at Coral Drive Medical, which is in Gulfview. So either way, I don't know if Professor will give you the telephone numbers so you could call if you need to make an appointment.
All right, Doc, before you leave, you can give the numbers for them to call to make an appointment.
Yes.
All right. Okay.
All right.
Do we have another call?
Oh, okay, go ahead. Yeah.
Do we have another call? Do we have any other calls?
We have a WhatsApp message. It says, can prostate cancer manifest as a mass anywhere else?
As a mask? I mean, yeah, well, this is what we were talking about, where the prostate cancer can sometimes present with weakness, low back pain, and weakness in the lower limbs if it has spread to the backbones. And if it's spread to the lymph nodes, it could present with one leg swollen where the glands are blocked. So not allowing, blocking the flow of blood back up to the pelvis. Yeah. So the feet could be swollen on one side, or you could have back pain and weakness of the lower limb because of spread. Yeah.
Another question here quickly. It says, good evening. Are you saying once a man is suffering with high blood pressure, he will have a erection problem?
No, I'm not saying that. I'm saying if the person has an erection problem and he has high blood pressure, then that is a risk factor that will make the erections worse if it is not controlled. It's not a cause, but it can make things worse. Yes, it is a risk factor for erectile dysfunction. And therefore, tight control on diabetes, high blood pressure, cholesterol, thyroid, testosterone, and reduction of smoking are all risk factors. Sometimes some person may have one risk factor, or they may have more than one, and you should address every single risk factor to get the best blood flow to the penis.
All right, we have a call. Let me take this one. Hello, good evening.
Yes, good night.
Go ahead, sir.
I'm in my 60s, and I function well, get a good erection, things like that. I try to do blood work like every 2 years. I did one recently, and everything was okay, but they said the cholesterol was just a little slightly above what it is supposed to be, and so they gave me some tablets for that. I also did a CT scan recently, and that showed that the prostate was enlarged, but like all the other organs, the kidney and all of that, they said everything was good with it. So I'm just saying, what could, well, I am on some advice now. I'm supposed to go and check the prostate, but the scan showed that it is a little enlarged. But barring that, all the other results were good, and all the other blood work, they read good. So I see someone in my 60s, as I said, I don't have a problem getting an erection or anything like that. But I just want to make sure, that you continue, to be able to function well and things like that. So what kind of suggestion you have for that?
Well, certainly the concern, the fear of this enlarged prostate is a genuine fear, but an enlarged prostate by itself means nothing unless it is obstructing the flow of urine. So you have urinary symptoms. If it is doing that, then that becomes a concern. Or if that enlarged prostate has a cancer. Now, we have a lot of small prostates with cancer, and this is why we depend so heavily on the PSA blood test and the rectal exam. So once they say the prostate is enlarged, it doesn't mean anything unless you have an obstruction or you have a cancer. So those are the two things we look for with an enlarged prostate. And both can be treated very effectively.
All right, we have another WhatsApper says, "Hi, good night. I have a brother who has been diagnosed with prostate cancer and is wearing a bag. Can you help, or can he be helped? Can he be helped? Sorry."
Oh yeah, yeah. If he has a bag, it means the cancer has got large enough or hard enough to block the flow of urine. If it is cancer, and we could certainly get rid of the bag by doing what we call a channel. We do what we call a channel tube, in that we widen the passageway in the center to get rid of the catheter so you could pass the urine normally. Oh yeah, that is a common problem where the prostate may have cancer, but It depends on the stage of the cancer, how curable the cancer is, because sometimes you can do, if it is curative, you could do a radical prostatectomy, or if you have got good control on the cancer with other treatments like radiation or brachytherapy, then you may need to make a channel to open out that passageway.
Right. We have another message here. Somebody says, my grandfather wants to know if the prostate is swollen, if it's wise to take another ultrasound before it reaches cancerous.
Well, this, just as I said before, being swollen doesn't mean cancer. Being swollen just means being swollen. As you get older, the gland gets bigger, but so does everything else, you know. Your belly gets bigger too. So it doesn't mean it has cancer. There are lots of things that get larger as you get older. What we are trying to do is make sure that there is no cancer hiding. Because it is enlarged doesn't mean it is a cancer. It means you have to run tests to find out if there's any suspicion of cancer in the prostate. So it needs to be investigated. Yeah. I certainly recommend everybody over the age of 40 should have a PSA blood test. At least, as for the minimum, do that once a year. And your PSA blood test shouldn't increase more than 20% of what it was the year before. So we don't just use one PSA, but we do serial PSAs and see if it is increasing too fast, if it is doubling in less than 10 months, if it is the increase in PSA, it does increase with age slowly, but it shouldn't cross 20% of what it was the year before.
All right, we have a call. Let me take this at this time. Hello, good. Well, okay, we lost that call. Go ahead.
Okay, well, just to let you know, we have just a few more minutes, so you'll have time for maybe one more call. 480-4121, 480-4121, and 463-7208, 463-7208. If you call within the next 30 seconds, we'll take a call. Otherwise, we'll have to wrap up at this time.
Okay, just one thing before we wrap up. There's a novel approach, new approach in the last few years, which is called penile rehabilitation. Penile rehabilitation, you're rehabilitating the penis. So people with erectile dysfunction, at night you're supposed to get 5 erections to bring, while you're asleep, to bring more oxygen to the penis, to prevent any scarring inside the penis. And then with these people who have difficulty getting erections or no erections, we give them a low dose of tadalafil, which widens the blood flow into the penis at night. It's not for erections, but it increases the oxygen. And many people with this approach take a nightly low dose of 5 milligrams of tadalafil can find they wake up in the morning with a better erections, and with time and the oxygen, if they have to add other treatments, they get a more effective erection with this low dose of tadalafil to bring more oxygen to the penis every night. It's called nutrition for the penis. So it increases the oxygen. So that has worked really, really well in Trinidad. We've gotten good results with that, and we add further treatment to it. Yeah.
Wonderful. Well, I don't think we have time for any more calls at this time. We need to close up. I just want to ask Riquen and George 30 seconds each, please, and closing remarks, and then we'll have our guests say something. George?
Wow. Definitely. I'm here. Trinidad and Tobago, we've been blessed this evening with an overflow of information, vital information that can save your life. Don't hesitate. Take that opportunity to take a step forward and do something for yourself, something that's good for yourself. Go get tested, all of us who are over 40, and ensure that you and your loved ones can enjoy you for many, many years to come. I love you, Trinidad and Tobago. Have a beautiful night.
Thank you. Riquen?
Well, I think we have an opportunity here to be our brother's keeper. And so if there's a man that we know, and we all know, we all have brothers and so on, we can, look out for one another, find out, if we doing our due diligence, so to speak, checking ourselves on an annual basis. And in so doing, I think we can help in terms of support and reducing the whole stigma as it relates to issues of the prostate and health. So that would be my encouragement. And of course, the recording is available that we can listen again to catch what we have missed.
Doc, as you close off, give your numbers and just close some remarks, please.
Okay, so for South, it is 220-7880. That is 220-7880 after 8:30 in the morning. And then for North at Medical Associates, it's 662-2766. 662-2766 in North.
Doc, so any final words, anything you want to say in closing?
Well, I think we've had quite a good, attentive audience who have asked very intelligent questions. There's so much to talk about. We haven't looked at men with kidney stones and urinary infections and so on. But definitely as far as the prostate is concerned, prostate cancer remains the most common cancer, and that is where the importance is. The good news is that if it is caught before it has spread outside of the prostate, then the cure rates are really, really good. And we're seeing more and more people walking around with PSAs of 0, which would never have happened years ago, because now we have all the treatments available in Trinidad. We have the brachytherapy, the external beam, the radical prostatectomy, and so on. So we can offer hope that people can get a cure, and if they do have problems with erection, that we can give them good erections one way or the other.
Dr. Lester Goetz, thank you so much for sharing with us tonight. Of course, as I said, we haven't touched everything. We're going to have you back at another time. I remember we discussed the women as well. We need to talk to the women because there are some things that women need to know as well. So we're going to be talking about that in another program. But thank you for what you've shared this evening. I'm sure that the men have been enlightened. Thank you so much for gracing us with your presence, and we will talk again. God bless you.
Thank you. Thank you for having me.
Ladies and gentlemen, we have come to the end of Men Talk for this evening. Thank you so much to our sponsor, Anaya Tony, the Feet Lady, and for all of you, those of you call, those of you who listen, we will be back with you next Saturday at 8 p.m. for another Men Talk program. Thank you so much to my co-hosts George and Riquen, and to Adesola in studio. And in fact, Adesola, it's back over to you.
Thank you
Bye-bye.
much, Professor.
Hey, this is Noel Professor Richards, inviting you to join me every Saturday night at 8 p.m. for Men Talk. We will talk about how to live, how to love, and how to lead. It's 1.5 hours of men talking about all the things that men talk about. So don't miss it. It's Men Talk every Saturday at 8 p.m. on Isaac The Promise Facebook page, FBN TV, and Isaac 98.1 FM, The Promise.
Hello.
Hey Jack, you missed the meeting yesterday, boy. What happened?
Andre, I was under some pressure, boy. Well, I know Uncle have diabetes, high blood pressure, and poor circulation. He couldn't even walk properly yesterday, so I took him to the feet lady, boy, Dr. Naya Tony. And let me tell you something, when they're done with him, he feels so good. You know the man forget he walking stick by them? When I go back for the next session, we'll get back, man.
I must send her number to my cousin. She have a pinched nerve, lupus, and I think she uncle got stroke. I had to see about my back pain too.
Well, Andre, what are you waiting for? Take these numbers down one time. 360-5166 and 478-7416. Dr. Anaya Tony, boy, the feet lady from Anaya Health and Wellness Center.